Gemifloxacin, also known as Factive, is a medication used to treat a variety of bacterial infections. It belongs to a class of drugs called quinolone antibiotics, and it works by stopping the growth of bacteria. It's important to note that Factive only treats bacterial infections and will not work for viral infections, like the common cold or flu. Using this antibiotic when it's not needed can cause it to not work for future infections. The daily dosage and optimal timing for taking Factive should be determined by your doctor, based on your specific medical condition and response to treatment. Be sure to follow your doctor's instructions carefully for the best results. Before you start taking Factive, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. The dosage and length of treatment are based on your medical condition and response to treatment. Make sure to drink plenty of fluids while taking this drug unless your doctor tells you otherwise. It's important to take Factive at least 2 hours before or 3 hours after taking other products that may make it work less well, such as quinolone, sucralfate, vitamins/minerals, including iron, zinc, and products that contain magnesium or aluminum, such as antacids, didanosine solution. For the best effect, take this antibiotic at evenly spaced times. To help you remember, take this medication at the same time every day. Continue to take this medication until the full prescribed amount is finished, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. If your condition lasts or gets worse, make sure to inform your doctor. If you experience nausea, diarrhea, dizziness, headache, or trouble sleeping, it may be a side effect of Factive. However, many people using this medication do not have serious side effects. Remember to tell your doctor right away if you experience unusual bruising/bleeding, signs of kidney problems, signs of liver problems, or symptoms of a severe allergic reaction. Additionally, be aware that Factive may rarely cause a severe intestinal condition due to a bacteria called C. difficile. If you develop diarrhea that doesn't stop, abdominal or stomach pain/cramping, or blood/mucus in your stool, contact your doctor immediately. Prolonged or repeated use of Factive may result in oral thrush or a new yeast infection. If you notice white patches in your mouth, a change in vaginal discharge, or other new symptoms, contact your doctor. Finally, keep in mind that Gemifloxacin can commonly cause a mild rash, especially in certain populations. If you develop a rash, stop taking Gemifloxacin and seek medical help right away. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. And as always, consult with your healthcare provider to determine the best time to take this medication and the appropriate daily dosage for your specific needs. Factive, also known as Gemifloxacin, is a type of antibiotic that can treat bacterial infections. However, it's important to be aware of the potential side effects. This medication may cause tendon damage, nerve problems, and nervous system issues. If you experience symptoms such as pain, numbness, weakness in your arms or legs, changes in your vision, or mental/mood changes, it's important to seek medical help immediately. It's also important to note that tendon damage can occur during or after treatment with Factive. If you develop joint, muscle, or tendon pain or swelling, stop exercising and seek medical help. People over 60 years old, those taking corticosteroids, or individuals who have had a kidney, heart, or lung transplant are at a greater risk for tendon problems. Furthermore, Factive may worsen a certain muscle condition called myasthenia gravis. If you experience new or worsening muscle weakness or trouble breathing, inform your doctor right away. Before using Factive, it's essential to discuss the potential risks and benefits with your doctor to ensure that it is the right medication for you. And as always, follow your doctor's instructions for the correct dosage and timing of this medication for your specific condition. Before taking Gemifloxacin, be sure to inform your doctor or pharmacist about any allergies you may have, as well as any medical conditions you may have, including diabetes, joint or tendon problems, kidney problems, mental or mood disorders, certain muscle conditions, nerve problems, seizure disorder, blood vessel problems, high blood pressure, certain genetic conditions, and any medications you are taking. Gemifloxacin may cause a condition that affects the heart rhythm, so it's important to discuss any heart problems or family history of heart problems with your doctor before using this medication. Additionally, low levels of potassium or magnesium in the blood may increase the risk of heart rhythm issues, so discuss any conditions or medications that may affect these levels with your doctor. You should also be aware that Gemifloxacin may rarely cause serious changes in blood sugar, especially if you have diabetes, so be sure to monitor your blood sugar levels regularly and discuss any symptoms with your doctor. This medication may make you dizzy and more sensitive to the sun, so it's important to avoid driving or using machinery until you know how it affects you, limit your time in the sun, and use sunscreen and protective clothing when outdoors. Gemifloxacin may also affect the effectiveness of live bacterial vaccines, so be sure to inform your healthcare professional before receiving any immunizations. If you are having surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Discuss the risks and benefits of using Gemifloxacin with your doctor if you are a child, an older adult, or pregnant. This medication may also pass into breast milk, so be sure to consult your doctor before breastfeeding. When taking Factive, it's important to be aware of potential drug interactions that could affect how it works or increase the risk of serious side effects. This means you should keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Factive is strontium. Always consult with your healthcare professional before taking any new medications or supplements while using Factive. If you or someone else has taken too much Factive and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 in case of emergency, or contact your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center for assistance. Remember, you should never share your Factive medication with anyone else. This medication is specifically prescribed for your current condition, so it's important not to save it for later or use it for another infection unless your doctor advises you to do so. Your doctor may also conduct lab tests, like kidney function and blood sugar, before and during your treatment with Factive, so make sure to attend all your medical and lab appointments. If you forget to take a dose of Factive, take it as soon as you remember. If it's close to your next dose, just skip the missed one and take the next dose at your usual time. Don't take a double dose to make up for the missed one. It is important to store Factive at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. Do not flush the medication down the toilet or pour it into a drain unless specifically instructed. When the medication is expired or no longer needed, be sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.